Welcome to Nursing Huddle with Mrs. Ignacio. This is the first series of lectures on mental health nursing. All the PowerPoints are coming from the textbook Introductory Mental Health Nursing by Cynthia Kinkelo. Here is Chapter 1, Mental Health and Mental Illness. So before we go any further, we have to define what mental health is and what mental illness is. So we see there's a long definition on the slide, but it is holistic. It takes into account all aspects of an individual's being, not only their emotional being, their psychological, as well as their social well-being. We also have to balance that with the patient's cognitive abilities, their behavior, as well as their emotional states, because our emotional states can change multiple times throughout the day, and that is normal, right? So in the morning, we may wake up, we may be excited, emotionally excited, happy. Something may happen throughout the day. Our emotions may take a turn for a different emotion. Maybe there's sadness, despair, maybe there's happiness. So emotional states can be fluctuating. Also, what goes into our definition of mental health and mental illness is how does this individual handle all of these changes? How do they handle stress? How do they relate to others? How do they express their feelings? Do they not express their feelings? Do they make healthy choices? All of these are really important when we talk about mental health. There's also cultural issues that we need to take into consideration, cultural practices, because some particular cultures, some particular religions are not as expressive of certain emotions. So we have to take all of these into consideration when we consider what is the definition of mental health and mental wellness, mental illness. So we have to take into consideration physical, mental, and social well-being to make sure that they are intact. And when we think about evidence of mental health, does this individual, does our patient make sound judgments? Do they accept responsibility for the outcomes, for the decisions that they make? Does this individual understand what it is to be loved and to love other people? Do they respond with humor? Do they respond with violence? These are all things to think about, again, when we're defining mental health and mental illness. So all of these things are also influenced by socioeconomic factor, their financial resources, right? Also biological, because we are a component of our biological mom, biological dad. So that's going to contribute to the way that we respond to the world around us. Also, there's various environmental factors to consider. Is it a safe place that these individuals are in? What was their childhood upbringing like? Okay, does this individual have the ability to realize their personal abilities? That comes with self-confidence, self-esteem. So these are all important things. And so there's no one, cookie cutter definition for mental health, mental illness. We have to think about mental health varies based on many different factors. And as we have each patient presented in front of us, we have to look at them in a holistic fashion. So when we think about mental illness, okay, so this is based on the patient's mood, their thinking, their behavior, how they tackle problems when they're faced with daily problems, when they're interacting with others, how are they able to perform their daily activities of life? Okay, we also have to look at their interpersonal relationships. How do they relate to other people? Do they have good relationships, strong relationships, strained relationships? Are they able to cope emotionally with difficulties in relationships? Do they have distorted thinking? Those are really important. In your textbook, on box 1 and table 1 gives the characteristics of various mental disorders, which we will get into in later chapters. But this is something to kind of, okay, bring our attention to say, okay, what's going on with our patient, okay? And do they have some of these red flags, things that we can consider disturbing? So when we look at box, we'll look at box 1, tab 1, and then table 1.1. Box 1.1 is on page number 2 of the textbook. We can know that there's warning signs of a mental health issue. And so changing in eating, changing in sleeping routines, sleeping patterns, feelings of hopelessness, that's always a red flag. Feeling that nothing else matters. If they're partaking in ways of coping, as in alcohol, substance abuse, illegal drug abuse, if they participate in hyper or reckless activity, riding their motorcycle at 100 miles an hour in the rain, maybe going and jumping off of higher landmarks, like maybe in the skate park. Well, I'm going to just jump off of this. I'm going to do something that is potentially dangerous or reckless. Thoughts of harming themselves. These are also warning signs of mental health issues. Changing in their thinking that include illogical ideas or magical thinking, believing that they can control the universe, control the stars. So these are all huge warning signs. So when we think about, again, this is box 1.1 on page 2 of the textbook. So comparison of mental health and medical conditions. So we are comparing in this table 1.1 anxiety, depression, schizophrenia, and bipolar. So with anxiety, the patient may present with sweating, headaches, tremors. So there are certain medical conditions that can mimic this as well. And those conditions are hyperthyroidism or pheochromocytoma. And so your pheochromocytoma, this is a condition in which the patient may have a tumor that originates in the adrenal gland. And remember, the adrenal glands sit on top of the kidneys, and they can overproduce certain hormones. So that could also lead to a patient having these physical symptoms, and that is pheochromocytoma. Now, the next condition to think about is depression. So the symptoms that a patient that is depressed may exhibit is going to be lethargy, increased sleeping, weight gain, difficulty concentrating. A medical condition that can also mimic this, though, is hypothyroidism, too little of thyroid hormone. Now, the third medical condition, and the third and fourth actually, is going to be schizophrenia and bipolar. These conditions, the patient can exhibit psychosis, and psychosis occurs when there is an actual break in reality. Their reality is not the same as the reality that the rest of the world is living in. Now, this psychosis can also be exhibited by patients that have systemic lupus erythematosus. So this is a patient that has lupus. So really, when we are looking at these mental illnesses, we have to rule out any medical, surgical kinds of problems with the patient to make sure that we're addressing any medical, surgical issues, as well as understanding if the patient does have a mental health issue. But we do have to rule out these medical, surgical kinds of issues first, okay? So we see that mental illness is seen in all cultures and all socioeconomic levels and all genders. So mental illness can strike anyone, okay? It doesn't matter if you're rich or poor, if you're Black, white, Asian, Hispanic, Latina, Native American, it doesn't matter, okay? It is an equal opportunity kind of attacker, I would say. Right? And so we think about the National Institute of Mental Health. They estimate that in 2019, there were 51.5 million adults with severe mental conditions. With mental conditions ranging from mild to severe. Mild can be anxiety, depression. Severe can be all the way to psychosis, right? So 51.5 million adults. Okay? And that is the National Institute of Mental Health. So that we're talking about in the United States. So in 2019, the United States spent $225 billion on mental health services. However, that was not enough. It's not enough. Even though we're spending all of this money, we still do not have adequate resources for our patients that need them. Okay. So issues to lack of access to care due to costs and lack of availability of services are compounded by the stigma. It's, oh, you have a mental illness, quote unquote. Oh, you had a mental issue, right? There's a lot of stigma that is surrounding, seeing a therapist, getting help for mental health issues, which is quite unfortunate because we would not shame someone. Well, maybe we would in this media and social media kind of environment. We wouldn't shame someone though if they required insulin because their pancreas doesn't make insulin. We wouldn't shame someone if they required medication for hypertension. We wouldn't shame someone if they had cancer and they needed chemotherapy. So the same thing should go for patients when they have mental illnesses because it is an illness of the mind. Okay, so think about it in that way when you're working with your patients, they have an illness of the mind. Okay, so what can affect our patients' mental health? Well, stress, definitely, right? Stress is one of the things that can negatively affect our patients. However, there is good stress. We'll talk about eustress in a little bit, but anxiety, fear of what's to come, what could happen. There's also grief and loss that could affect the patient's mental health. Adaptive response influences. How does this person adapt to changes that are taking place? How have they been programmed? What did they learn in their childhood? How to adapt to these changes? Because there's going to be changes in life. Sometimes we make plans on how we're going to start our morning and something can change that, do a whole 180-degree turn. So our conditioning, our cultural influence, and our mental resources all affect how we adapt to these changes. And the preferred response, of course, is to respond with constructive measures, thinking of things in a positive light, trying to make the best of a situation, developing those coping strategies. Okay. So mental health is achieved when an individual is able to understand and maintain that balance between the ups and downs of everyday life, and they're able to adapt to those changes of everyday life. Now, stress, anxiety, grief, loss, they're all unavoidable circumstances in life. It doesn't matter who you are, where you are in the world, you're going to experience all of these things: stress, anxiety, grief, loss. So what we want a patient to be able to do is to really process these situations, these feelings, these emotions, these circumstances, and what will impact a patient is their cultural influences, their religious preferences, their religious beliefs, their family background, their genetics. If they have any sleep disturbances, that's going to affect them. Substance abuse can affect how they process this. And actually, they can have sleep disturbances because of their lack of ability to process it. They can have substance abuse because of them not having the appropriate coping mechanisms. Also, if an individual is exposed to trauma or violence, that could affect their mental health and their ability to process their daily life activities. So one of the things that is important for the nurse is to ask the patient, what has worked for you in the past? How have you been able to successfully cope with these stressful activities in your daily life? So that's going to be a great question to ask. What has worked in the past? What successful coping strategies did you use before? And you can see that, in test questions, NCLEX questions. That's always a favorite kind of concept to make sure that we understand. So we want to understand also that the patient's past experiences with stress, anxiety, and grief help to shape their response to their current situation. And it's okay if they say, you know what, I didn't have very good coping strategies in the past. Well, this is an opportunity for the nurse to introduce some positive coping strategies, some positive coping mechanisms to help the patient pass this grief, this stress, this anxiety, whatever the patient is going through. So when we look at cultural heritage, beliefs, norms, and values, we know that culture is a common set of practices that are central to a group of people. And this results in a cultural identity. They identify with a particular culture. Okay, and there's many cultures, there's many subcultures. And so cultural variances in mental health help a patient either to cope or sometimes they don't help a patient to cope. In table 1.2 in your textbook, that is on page 5, we see common examples of culture-bound syndromes. And so these cultures range from Asian kinds of cultures to Latin American to Mediterranean, Western African, Indian, Japanese, East African, Middle Eastern. So many different examples of culture-bound syndromes. So take some time to look through that table. I think in the classroom we'll have a little bit more time to discuss. Okay, so coping is either learned from past unpleasant experiences, maybe they observed others, how they dealt with similar situations. And growing up, I always adopted the idea of I can learn from other people's mistakes. So I don't necessarily have to make the same mistakes. Now, sometimes you're going to make the same mistakes, and that's okay, but you don't necessarily want to make the same mistake multiple times. Hopefully an individual can learn once from, once, twice, or even maybe 3 times from that mistake and not make that same kind of mistake again. Now, sometimes it doesn't work for some people, and so that's where the nurse can step in and provide coaching and mentoring and helping the patient refocus on their goals. Okay, so coping can either be a conscious mechanism or unconscious, and it can be learned or automatic, as well as being positive or negative. And as we are answering NCLEX questions, as we are dealing with our patients in real life, we want to use positive coping mechanisms. Okay, so we also talk about elimination strategies. There are certain cultural, religious, folk healing, magic, traditional medicines, right? Religious rituals that help with some people, some groups of people think they help with their mental health. When we think about prayer rituals, we think about praying, maybe candles, eggs can be used. So there's eggs can be used to symbolize fertility. So there's different things based on the religion. These different symbols mean different things. So there could be weeds, roots, pitchers, metals, different religious paraphernalia can be used. Music can be used. Talking to God, meditation, prayer rituals, all of these things fall under your religious rituals. The thing that we have to make sure that we don't do as nurses is to place our belief system on the patient. Now, if a patient asks you to pray with them and you're okay with it, it's okay to pray with them. However, don't go in offering prayer for your patients because they may not pray to the same being that you pray to. They may not have the same beliefs. And so we don't ever want to impose our beliefs on our patients. We want to be respectful of theirs. And if you do not feel comfortable praying with your patient, maybe they are a Wiccan or they believe in a different religion than you do. You don't have to pray with them. If you don't feel comfortable, just say, no, thank you. I will refer the chaplain. I'll refer you to a rabbi. I'll refer you to an imam, whoever their religious leader is. That would be something good for us to do. And each facility, they have religious figures available. They usually have a chaplain that can come and pray with your patients and their families if it's requested. Okay. Cultural and ethnic traditions may be the first choice for managing mental illness, despite the available services. So that may be something to be aware of, that maybe they're working through their church in order to receive services regarding their mental illness. So when we think about mental illness, we have to also look at coping strategies. So how do we get our patients to cope? Okay, now we talked about we want positive ways of coping. Okay, so not everybody deals with the stress, anxiety, grief, loss in the same way. So when we think about coping strategies, there's 4 categories. So there's adaptive and palliative, and those result in positive outcomes. Okay, an individual's successful management of stress or anxiety is referred to as an adaptation. So therefore, when a rational or productive way of resolving a problem to reduce stress or anxiety is used, it is said to be adaptive coping. Now, palliative coping is when the solution temporarily relieves the stress or anxiety, but the problem still exists and must be dealt with again at a later time. And that palliative can be very useful, especially if emotions are high. It's a really in the moment kind of stressful situation. It's not really necessarily the best time to make decisions during that level of high emotion. So palliative kind of says, okay, we're going to put this on the shelf, come back and process it later when things have cooled down. Okay, so those are positive outcomes. Now, when we think about maladaptive and dysfunctional kinds of coping, they result in negative outcomes. Okay, so if unsuccessful attempts are made to decrease the anxiety without attempting to solve the problem, the strategies are described as maladaptive coping, and the stress or anxiety remains. For example, so we have a drama student, they might decide to ignore the anxiety and go to the movie the afternoon before the performance, rapidly look over the lines immediately before going on stage. So this drama student did not really respond properly because they were stressed out about their performance, but they were not properly prepared for their performance. So instead of becoming properly prepared, they did something else. Okay, and that is going to, of course, have a negative outcome. Okay, when we think about dysfunctional, we think about not normal, and something that is not going to have a positive outcome. Okay, so the individual who does not attempt to reduce the anxiety or solve the problem is considered to have dysfunctional coping. Okay, so if this same student decided to get drunk the night before the performance, this drama student, right, has a performance the next day, and then they fail to show up on time, they show up during the second act because they're hungover, that is dysfunctional. Okay. And so that is not a positive outcome. That is a negative outcome. Okay, so we also can look at table 1.3 on page 7 of your textbook. This talks about promoting adaptive coping strategies, and these are going to be great positive kinds of strategies: reframing and visualization. So here we go with examples of reframing irrational thoughts. So the patient may say, I always mess things up. So the restructured thought is this: even if things didn't turn out right this time, I can do it differently next time. So we put a positive spin, right, on what the patient is saying. So we're literally reframing it, putting a different frame on it in a positive way. So the patient may believe he never does what I want him to do. So the restructured positive thought is if I want him to do something, I need to communicate that to him. Okay. Another irrational belief, an example is I should have done better on the exam. So a restructured positive thought can take that same thing and say, I can study harder and do better on the next one. Okay, so that's all going to be important. Reframing, helping your patients reframe their situations, and that's a part of a positive coping strategy. So we want to promote adaptive coping strategies. Remember, adaptive coping strategies have positive outcomes. And when we think about positive outcomes, adaptive and palliative coping are the way to go. Negative outcomes are going to be maladaptive or dysfunctional. Okay, maladaptive and dysfunctional, they do not address the issue that is the root cause of the problem. And that is really important to address the root cause of the problem. Okay, so effective coping strategies, there's so many listed here. These are great. Positive self-talk, reframing irrational thinking. I do this sometimes with my daughter because she goes on to this what if scenario. And then I go with her, I'm like, okay, well, what if this? What if I turn into a cow and jump over the moon? And that kind of makes her chuckle a little bit and realize that, okay, I need to bring down my irrational thoughts and let's look at the reality of what's being dealt with here. Another thing is assertiveness training, problem solving, and assertiveness always begins with I statements. I feel angry when. I am hurt when. And assertiveness training is really great because it allows the individual to know what your feelings are and you are making your feelings known. And sometimes that could be hard because we're becoming vulnerable at that time. Communication skills, conflict resolution, knowing how to communicate effectively without being loud or maybe resorting to violence. Those are all important things that we need in our everyday lives. Okay, relaxation techniques, meditation, those are going to be important because many times our mental health is affected by stress and how we process that stress. Support systems are going to be important. Does this individual, does our patient have a support system? Do they have family? Do they have friends? Is there anyone that can help them in their time of need? Also, a sense of humor is going to be very helpful because things are going to happen in life. How we process those things that happen to us determines whether or not we have mental health or mental illness. So also having a practical attitude, a matter of fact attitude can be helpful. Self-care is also important, and that includes plenty of rest, eating healthy choices for our foods, making those healthy choices, getting enough sleep, getting enough exercise, having time for leisure, downtime so we don't burn out. Nurses are really guilty of that, not taking that downtime. Also, avoiding stress increasing substances like caffeine and alcohol. Those all fall under self-care, and consumption of these harmful substances can really have a negative impact on our mental health. And then faith, religious beliefs, they will help us when we are faced with these stressful situations. And our faith, meditation, those kinds of things, spiritual power, right? Those are ways to promote adaptive coping strategies. Okay, let's talk about stress. So, stress is something that threatens our well being. Okay, so situations that threaten our well being, they can cause us stress. So, we may have to adjust or adapt to these particular situations. So, distress is a negative stress and it is very demanding and it is exhausting in nature. So, that is distress. Eustress is positive, motivating stress. And this can help us. So we have this race coming up. We've been working out for it. We've been training for it. We're a little nervous. We're a little stressed out, but that's okay because it's going to help us to channel our energies into doing our best for this particular race, right? Now, acute stress gives you a fight or flight response. And so this is, for example, if you're walking down the street, you see a wild rabid dog coming towards you, right? That's when your epinephrine is going to kick in, right? Your adrenaline is going to be kicking in, right? So that's an acute stress. Now, chronic stress is ongoing, is continuous. This could be an example of someone living in an environment at home that's not safe, okay? So you're constantly in this ongoing stressful situation, okay? Common symptomatic categories, well, there's physical stress, mental stress, emotional stress, and behavioral stress, okay? So when we think about anxiety, and one of the things as we talk about all of these different conditions, I want you to think about what you can do as the nurse, okay? What kind of coping strategies can you help the patient employ and be able to recognize negative coping strategies because those are the things that mental health test questions can be made of. I need to recognize the clinical cues that this is a negative kind of coping strategy and what can I as the nurse do to help the patient use a positive or adaptive coping strategy. So reframing is one. Visualization is another, right? Helping the patient visualize a positive outcome, helping them to meditate, maybe taking them to a peaceful place of solitude, right? Those are all ways that we can tackle these negative things. So when you answer these test questions, that's what you need to focus on. And mental health is a little challenging because we get into it's not okay, the patient has a sucking chest wound, what do you do? It's kind of a little more fuzzy, a little more squishy. It's not necessarily uh, concrete when we think about mental health. So that's why some people struggle with mental health a little bit, but hopefully in our discussions, you'll be able to pull all of that information through. Okay, so when you have a patient that has this chronic okay, I'm sorry. I'm on anxiety now. Sorry about that. I was just wrapping up talking about how you should help your patient deal with their stress, right? And so we talked about stress. Let's jump into anxiety now. Okay, so what is anxiety? So the patient will have a feeling of apprehension, uneasiness, or uncertainty. And so there could be, this is due to a real threat or a perceived threat, okay, from an unknown source. So the threat could be real or not necessarily real, but it may be real in their mind. And so when someone has anxiety, the response is automatic and there's an unconscious biological response. And that could be elevation of heart rate, elevation of blood pressure, respirations. These are all things that can happen to a patient that is feeling anxiety. So now normal anxiety is necessary for survival. So this gives us energy to maintain daily life, to pursue our goals. Now, acute anxiety is short term, right? Maybe I have a big event coming up, and so I experience this anxiety based on this event. Once the event is over, then my anxiety goes away. Chronic anxiety is over a long period of time. So anything that's over a long period of time, especially something that can negatively impact your health, can manifest itself in different ways. It can affect the patients in different ways. The patient can experience chronic fatigue, insomnia, so they have a sleep pattern disturbance. They're not able to concentrate well. Their work may be impaired. Their social relationships may be impaired. So this is all, when we look at the patient, we have to ask these questions. We have to carefully examine not only, their vital signs, but what are the relationships, outside of this office, right? Our office. How are their relationships with family, with friends, with their coworkers? Because all of those can give us an idea about their mental health. And as a nurse, whenever we talk about different conditions like stress, like anxiety, I want you to think about, okay, patient is presenting with this. What can I do as the nurse to help them deal with it? So whenever you have test questions and a patient has anxiety, you will, first of all, you need to recognize the clinical cues that they have anxiety. And you need to know that, okay, I'm going to be de-escalatory. I'm going to speak in a calm voice. I'm going to provide them with information because they may have anxiety because they don't know what's to come, right? And so on page 10 of your textbook, there is a table that has a common signs and symptoms of anxiety. That's going to be an important thing to look at. And this slide is also showing the same information, but on page 10 of your textbook, table 1.4, we have common signs and symptoms of anxiety. Remember, the signs is the objective information. That's what we see as a medical provider, and symptoms is what the patient tells us, okay? So there's 4 levels of anxiety, and we need to be able to recognize them, not only for test questions, but, for NCLEX questions, but when we're working with patients, you need to see if they have anxiety because you want to prevent it from escalating if you can, okay? So mild anxiety is natural. It motivates us to move forward, to be productive. Moderate anxiety is a little uncomfortable and it's difficult to tolerate, but patients can get through this moderate anxiety. Now, severe anxiety is exhausting, both physically and emotionally, okay? These patients may end up with desperation and they are seeking ways to relieve their mental and emotional turmoil. Now, panic level anxiety, this is dangerous. So this is a patient that is in hysteria. This is a patient that may have suicide attempts, may have violence. So we have to, if we are given, a question or a scenario with the patient that is anxious and they start to have these behaviors like pacing, tapping, making fists, pounding their fists. This is a patient that is escalating, and the nurse has to intervene before it becomes a panic, hysteria, suicide, homicide, violent kind of scenario. That's the role of the nurse to recognize these cues and then intervene to keep the patient safe, the staff safe, and everyone safe. So safety is going to be super duper important. Okay. All right. So what are some factors that can contribute to stress and anxiety? Well, there's things that are outside of us and things that are inside of us, right? When we think of ourselves as humans. External stressors can be abusive relationship, poverty, life circumstances, right? Adverse life circumstances can be external stressors. Internal stressors could be physical, psychological. It could be due to the kind of personality the patient has. Maybe they're a perfectionist. It could be due to emotional triggers. Maybe there's things in their past that causes them to have that kind of response. Things that can trigger them. So all of these are important when we're examining, the patient and their stress and their anxiety. And again, how the nurse is going to properly intervene. Okay. All right, grief and loss is a huge thing to think about when we're working with our patients, and that could definitely affect their mental well-being. So grief is the emotional response, right, when we are faced with loss. And loss could be the loss of a loved one, the loss of a limb, the loss of freedom, right? Maybe the person has an illness where they're not able to drive anymore. So that's a loss. So losses can come in many different ways. So we have to think about what is the patient facing in terms of grief, okay? Now, loss is an actual or perceived status change, right? So, okay, it could be loss of a job, loss of a position. In this case, it also could be loss of the ability to do certain things, right? So bereavement is natural, it's a healthy process, and it emerges in response to any significant loss. And again, it's not just the loss of a loved one, like a spouse or a mom or a dad or a child. It could be any kind of significant loss. People that have lost their houses due to tornadoes, hurricanes, natural disasters, that is a loss, and they have to go through this healing process, okay? Mourning activities are influenced by beliefs, religious beliefs, cultural beliefs, as well as customs, okay? So there are different types of grief. Anticipatory grief is we're kind of anticipating that there is going to be a loss. So if a patient is told that, okay, the patient has stage 4 breast cancer in both breasts, she's going to have a double radical mastectomy, she's going to have both breasts removed, that patient may start experiencing anticipatory grief because she knows she's going to end up losing her breasts, okay? Conventional types of grief, this is grief experienced following a loss. So this is the loss of a loved one. So remember, children and adolescents, they process things differently. So they may not fully understand what death is. They may not fully understand the permanence of it. So that's something to keep in mind when you're working with that particular patient population. Now, conventional grief is also could be a temporary or permanent loss. Maybe they have a loved one that has this illness that has to go through this kind of treatment, and they may not be able to do things that they once loved. But once the loved one has been made a full recovery, they may go back to those kinds of activities that they love. And so that could be a temporary kind of loss. Permanent is, of course, it's forever, right? So grief is a process, and Dr. Elizabeth Kubler-Ross has a great stages of grief and loss, and that acronym is DABDA, D-A-B-D-A. So it's denial, anger, bargaining, depression, and acceptance. So DABDA is a great way to remember the stages of grief and loss, and that is from Dr. Elizabeth Kubler-Ross. So when we think about the grieving process, we think about, well, again, anger, hopelessness, fear, guilt. We have to understand that the big thing that kind of heals when someone is going through grief and loss is time, okay, time. And so we want to place these lost things into memory, and there's going to be a new normal, okay? And adapting to loss is a learning process. There requires adaptations. So if you have a patient that doesn't adapt to change very well, they may in fact have difficulties as they try to navigate this new kind of life, right? Because the loved one is gone. Okay, and they have to learn to accept that loss is a part of life. It is definitely a part of life. And so that's where we got a lot of patients that may have mental illness issues, and a loss can trigger an acute kind of downward spiral for these individuals. So we have to also look out for those red flags. Okay, so here's the Dr. Elizabeth Kubler-Ross. So denial, anger, bargaining, depression, and acceptance. This is your DABDA. So denial, shock, disbelief. No, this can't be happening to me. The doctor told me this, but the patient may say, the doctor told me I have terminal disease. I only have 6 months to live. Well, I'm planning my vacation next year. I'm still going. Okay, that's denial. Okay, that's shock, disbelief. No, don't believe it. Anger. Okay, God, why did you let this happen to me? It's not fair. Okay, bargaining, postponing acceptance of the loss. Okay, God, if you heal me of this condition, I promise I will go to church. I will give you the glory. Everything will be great. I will serve the poor, right? Depression, this is a profound sadness, right? Prolonged mood of sadness because of this loss. And acceptance is, okay, I accept it now. I've made my amends. I've talked things out with my family and friends. I'm going to accept the reality that the end is near. All right, so those are the stages of grief. So grief is a process, and the patient needs to be able to adapt to this. Okay, so let's talk about dysfunctional grief. Okay, so anything that's right, is not normal. So the patient is not able to cope with the loss in a positive way. Okay. So if we have unresolved grief, this is incomplete grief because of maladaptive kinds of scenarios or symptoms going on. So what can contribute to a patient having this dysfunctional grief? Well, maybe it's a socially unacceptable death, right? Maybe it's a missing person due to war. We don't really have all of the remains, but we know that they were in this aircraft and there's nothing left of the aircraft. It could be multiple losses. Maybe they just recently lost their dad, then they lost their mom, then they lost their son. I think Joe Biden went through this kind of tough scenario where he lost his wife and his children. So that's an example of something that could be really tough grief, right? Unresolved grieving from previous loss. There could be survivor's guilt. Some of the hostages that were probably released in Israel may have survivor's guilt. Okay, they probably saw some of their fellow hostages that didn't survive. Okay, so also dysfunctional grief can manifest itself in the individual having thoughts of suicide, like I don't deserve to live. They can have a marked decrease in function, delusional thinking. They may even have hallucinations. So there's a lot that goes into this dysfunctional grief. And as nurses, our role is to look at what's happening and to see how we can intervene. What resources can we provide the patient? So we want to really make sure that patients that are facing this loss, that they have clinical attention, especially if they have prolonged bereavement. And so usually the time frame, especially for NCLEX questions, is 1 year. Okay, so if you have a scenario, you go into the home, your home health nurse, and it's been 2 years since the death of their daughter, and the mom takes you into the room and says, this is my daughter, she died 2 years ago. The room is exactly as she left it, right? With the dirty clothes, unmade bed, whatever the case may be. And I'm not touching this room. That shows you that that's not a normal kind of grief. That is a dysfunctional grief. Okay. I'm not saying that she should just throw all her daughter's things away. People deal with things, in the time that they need to, but usually 1 year for NCLEX question purposes is the time frame. So if it is a woman, 5 years later, she's still wearing her wedding ring, she's still, hasn't put her husband's things, to the side, that should be a sign for you in your NCLEX questions that, okay, this is a dysfunctional kind of grieving. So as a nurse, we want to use open-ended statements. We want to determine what support systems are available, what past coping strategies were helpful, and then we can advise the patient, okay, maybe you can journal. Maybe you could be a part of this support group. Maybe you could be a part of this religious group. Again, we always want to provide resources to help the patient deal with what they're going through. All right, we've got some questions to go through from chapter 1, and here is the first one. We're going to tell whether the following statement is true or false, and you can pause the video before we go to the answer. So stress can help people function at optimal levels. Is that true or false? Pause the video and then respond. So this is true. Stress is a part of everyday living. Mild stress can motivate and propel people toward accomplishment and success. Okay, so mild stress is normal when we face it, but when we have moderate, severe, or panic stress, now we're getting into other areas, okay, that could be potentially unsafe. All right, here's question 2. Grief that comes when one is expecting a loss in the near future is called conventional grief, dysfunctional grief, anticipatory grief, or chronic sorrow. Pause the video for you to think about the response. The correct answer is actually C, anticipatory grief. So anticipatory grief is a response in individuals or families that occurs when a loss is expected in the near future. It can be a helpful concept for nurses working with patients with terminal illnesses and patients who are anticipating the loss of a body part or a change in body functioning. So anticipatory grief. Okay. Question 3. According to Dr. Kubler-Ross, which stage is the first step of the grieving process? Is it anger, denial, acceptance, or bargaining? Pause the video and try to respond. So denial, right? That is the first stage of grief. And a person who has experienced a loss wants to avoid the reality of it and may act as if nothing happened. Denial allows a person time to gather coping strategies for the grieving process ahead. Okay, so that is our last question. And remember, Dr. Elizabeth Kubler-Ross has those 5 stages of grief and loss, and the acronym is DAB-DA. Okay, DAB-DA. Denial, anger, bargaining, depression, and then acceptance. This concludes chapter 1. Thank you.